No, I think you can see. Now you can see.
Yes, sir.
Yes, sir.
You want me to start from the back slide?
So we heard this that anxiety levels are reduced in the patients who are admitted alone, so immune system comes down. After that,
Okay,
you got disconnected.
okay, okay. Now, okay. It is often observed that patients who survive critical illness experience high rates of anxiety and depression that can persist from months to years after hospital discharge. COVID-19 patients exhibit a wide range and significant psychological stress that can impact the general health of the patient. Anxiety, panic, stress, depression have been linked to infectious epidemics. Not only COVID-19, any infectious epidemics, anxiety, panic, stress, and depression will be there because lack of knowledge, false facts, okay, wrong information, social media, so many things have come. You also have experienced COVID-19 when COVID-19 was on the peak in the 2020. So many news every day. If we open the WhatsApp groups, so many tips, wrong facts, wrong things about COVID-19. There are certain YouTubers who have posted that COVID-19 is a false thing. There is nothing like COVID-19. It is only a hoax. People just want to make money through vaccinations. That's why they. So these are this type of so much of panic city will develop depression in the patients. Patients also have a risk of developing social stigma and xenophobia. The role of physiotherapists in the management of anxiety and stress is becoming popular and recognized in the current medical scenarios. And the research is based on the practice is limited. See, physiotherapists play a very important role in reducing the anxiety and stress. It is becoming popular slowly, but current the research wise, it is still on the baseline. Aerobic exercises, breathing exercises can be effective in reducing anxiety and depression. In a randomized clinical control trial on role of physiotherapy and COVID hospital anxiety and depression in COVID-19 patients, the results demonstrated that adequate medical care and physiotherapy in the form of aerobic activities, deep breathing exercises, psychological support by verbal communication, along with effective medicines, can alleviate the hospital and acquired anxiety and depression in COVID-19 patients. In this research, this is published in Egyptian Journal of Physiotherapy, our own paper. So we have done research on 40 ICU admitted patients. So in that we have seen that when we give aerobic activities, light aerobics and deep breathing exercises, verbal communication, we used to talk at least 10 to 15 minutes with each patient and give moral support to them. And then some medicines, regular allopathic medicines, and then our own university have developed one special Ayurvedic medicine. It is called as Raj Nirvan Bhati, RNB, and a quath they have made one kada in English it is called as quath, Raj Nirvan quath, RNQ, RNB. So these medicines also we have given to these patients. So we have seen that patients have alleviated from anxiety and depression after that. Now the various techniques that are employed in the COVID ICU are, first one is active cycle of breathing technique, ACBT. ACBT is an active breathing technique performed by the patient which helps in clearing the chest and improving the lung function. Technique. The technique is performed in 3 steps. Number one, breathing control. This helps in relieving the tightness of chest, difficulty in breathing, and promotes relaxation. The patients were asked to breathe in and gently through the nose while keeping the shoulders relaxed, and patient was asked to close the eyes and concentrate on breathing. Deep breathing exercises. The patients were asked to take a long, slow and deep breath through nose, hold for 2 to 3 seconds and breathe out gently and relax like a sigh, like that. Post expiratory technique, the patients were asked to take a long breath in and asked to blow out in a single phase through the mouth. This is the way. So this is ACBT. Next, proprioceptive neuromuscular facilitation of respiration, PNF in respiration. PNF techniques improve the respiratory functions such as tidal volume, inspiratory reserve volume, expiratory reserve volume, inspiratory capacity and vital capacity. Technique. The patients were made to lie flat in the supine. The therapist placed his open hands on the lateral surface of 8th, 9th, 10th and 11th ribs bilaterally. We will be counting the ribs from the lower side or on the upper side by taking, if you are counting ribs from the upper side, from the angle of Lewis we will be counting. Angle of Lewis is, you have the second rib or from the bottom side you can count. 8th, 9th, 10th and 11th ribs bilaterally on the patients. The therapist then instructed the patient to take a deep breath. At maximum inspiration, the therapist asked the subject to sorry, asked the subject to hold the breath for 5 seconds while applying minimal manual resistance to the lower ribs bilaterally, which is directed downwards and medially. Downwards and medially. Later, the patients were asked to breathe out maximally at maximal expiration. The therapist pushed the lower ribs bilaterally in downward and middle directions. The cycle was repeated 10 times. I just hold here. You can go through the slide so that the technique is perfectly understood by you.
Yes, sir.
Right? Shall I
Fine.
proceed?
Yes, sir.
Yes, sir.
You need more time?
No, sir.
Shall I proceed then?
Yes, sir.
Okay. The PNF techniques stimulate proprioceptive and tactile stimuli which produce consistent reflexive responses on respiratory muscles, leading to expansion of ribs, increased epigastric excursion, respiratory depth and rate. It also properly aligns the respiratory muscles with respiratory rhythms. Then we have given active light exercises. These are the active light exercises. The first one is, these are all we have given to alleviate the anxiety in the patients. Foot acupressure. We have, this is figure A, foot acupressure. We have asked the patient to press the foot and hold for few seconds. Then foot exercises, dorsiflexion and plantar flexion. Knee to chest exercise, bringing the knee to the chest. Finger exercise, closing, getting nearer and getting away the fingers, palmar and dorsal interossei activation. Then we have knee exercises again. Then Padmasana. Take a deep breath in the Padmasana. Shoulder exercises, shoulder abduction. Trunk exercise, shoulder abduction, and then shifting towards the opposite side. Then we have butterfly exercise. Then we have wrist exercise, wrist rotations, flexion and extension, neck rotation exercises, and neck bending exercises. You can see the slide for a few seconds. Okay, sir. New one. Next, new role of physiotherapy in management of dyspnea and improving SpO2 levels in COVID-19 patients. How to manage the dyspnea and improve the SpO2 levels in COVID-19 patients by physiotherapy. The technique what we have used here is neurophysiological facilitation of respiration, NPF. NPF techniques produce reflex respiratory movement response by application of external proprioceptive and tactile stimuli that can alter the rate and depth of breathing. There are various techniques in NPF. In this case, we have performed thoracic verbal pressure, vertebral pressure, co-contraction of abdomen, intercostal muscle stretch techniques. Thoracic vertebral pressure. The patient was positioned prone. A high manual pressure was applied to the thoracic vertebra in the region of T2 to T5, and a low manual pressure was applied to the region of T9 and T12. The pressure at each vertebral level was given for 20 seconds. This increased the rate and depth of breathing by dorsal root mediated intersegmental reflex. The patient will be positioned prone, and from T2 to T5 you will be pushing the vertebral pressure, you will be applying the pressure downwards uh, on the vertebral spine. T2 to T5 you will be giving high pressure, and then from T9 to T12 you will give the moderate pressure. At each vertebra you will be holding for 20 seconds the pressure. Now what is the physiology behind this is the increased intersegment dorsal root mediated intersegmental reflex is activated, intercostal muscles are activated, and then the rate and depth of breathing is increased. Intercostal stretch. The patient was made to lie flat in supine position. The limbs were positioned in neutral position. The therapist with his index and middle finger applied pressure over the intercostal muscles between the second and third rib bilaterally for 20 seconds. The pressure is directed caudally toward the next rib but not towards the vertebra, and then released. The cycle was repeated for 3 minutes. This stimulates the respiration by intercostal stretch reflex. I repeat. In this, first we will make the patient in the supine position flat. The limbs are positioned in the neutral position of the patient. Now the therapist with his index finger and middle finger applies the pressure over the intercostal muscles in the second and third rib bilaterally for 20 seconds, directed caudally like this, not like this. It is directed like this for 20 seconds. Now co-contraction of the abdomen. The patient was made to lie in supine position flat with limbs in neutral position. The therapist then applied moderate and firm pressure on the lower ribs and pelvis at right angles to the patient on the same side. The technique was repeated bilaterally, one after the other side. The pressure was applied for 20 seconds. The cycle was repeated for 3 minutes alternatively. This technique activates the abdomen muscles by stretch reflex. The patient was made to lie supine, flat, limbs in neutral position. Now the therapist apply the moderate to firm pressure on the lower ribs and pelvis at right angles alternatively, right side and left side. The cycle is repeated for 3 minutes. So this is the techniques we have used. You can see here. This is the intercostal stretch we are giving. This is the abdominal one. Co-contraction of the abdominals. Next, acupressure. Acupressure is a method of massaging various acupuncture points with fingertip or knuckles. Acupressure was proved beneficial in patients with respiratory disease associated with cough, dyspnea, and congestion. Technique, we have chosen the LU10 acupuncture point of the lung meridian, which is situated at the index finger. The point was stimulated with the therapist's thumb for 20 seconds, 5 cycles in each session. This point is believed to increase oxygenation, decrease cough, and respiratory distress. This is the point where you have to press for about uh, 20 seconds. We have seen whenever we applied pressure on the screen, the SpO2 level shooted up. From 80, it used to shoot up to 91, 92, 93, 94 SpO2 levels. That much effective this acupuncture point is. So this is the area at the junction of thumb and the index finger, center point. This is LU10 of the lung meridian acupuncture point. You can stimulate this. Next, exercises to improve immunity. Now we will see the first exercise. This is the how the patient will be sitting on the stool elevated. This exercise is called as Viparita Karani with chair. Procedure, while lying supine on the floor with hip and knee flexed to 90 degrees supported. With chair against the gravity, maintain this posture for 5 to 10 minutes and concentrate on your breathing during the whole posture. Advantage, improves the blood circulation, lymphatic drainage of upper part of the body, which enhances immunity. Precaution, patient with glaucoma, hernia, and uncontrolled hypertension should not do this exercise or should do with precaution. I again show this is the Viparita Karni exercise. Next, short indoor brisk walk. Procedure, walk indoors by swinging your arms during walking within your home rooftop or balcony for 5 minutes at regular intervals. Advantages, maintains healthy weight, prevent or manage various conditions including cardiopulmonary problems, type 2 diabetes, strengthens musculoskeletal system, alleviates moods, improves balance, coordination, and immunity. Precautions, patients with elevated blood pressure, cardiomyopathy, valvular heart diseases, complex ventricular ectopy, and uncontrolled metabolic diseases should do walking with proper precautions and under medical practitioner guidance. The third one, see, this is the third picture. Third exercise, assisted fish pose. This one. Two pillows are kept under the trunk. Assisted fish pose. Sit on the floor or mat in long sitting position. Place a pillow or bolster just at the back of you. Slowly lower your back and shoulders onto the bolster. Straighten your arms out to the sides. Note that your hips should be on the mat or floor. Close your eyes and concentrate on your breathing for 3 minutes. Advantages: improves chest wall mobility and strengthens the respiratory system. Precautions: patients with recent head injuries, increased intracranial pressure, uncontrolled hypertension, low back pain, lumbar disc disease should take necessary precautions before doing this exercise. Next, cobra pose. This is the cobra pose. It's also called as Bhujangasana. Lie on your stomach or on floor or mat. Engage your abdominal muscles by drawing your navel up and in towards your spine. Bend your elbows and place your hands down on the mat next to your ribs. Keep your thighs on the ground as you inhale to press into your palms and lift the chest off the ground. Keep a slight bend in your elbows while squeezing the shoulder blades together. Hold this pose for 5 breaths and then slowly lower back down. Repeat the procedure for 5 times a day. Advantages: stretches the muscles of shoulder, chest and abdomen, thus improving the ventilatory efforts and capacity. It decreases the stiffness of the lower back, strengthens the arms and shoulders, increases flexibility, invigorates the heart, elevates the mood and have immunity. Precautions: patients with recent shoulder or arm injuries, osteoporosis, advanced sciatica or cervical spondylosis should perform this exercise with precautions and under strict medical practitioner guidance. Next, exercise number 5, tree pose. This is the tree pose, exercise number 5. Stand in straight standing posture, that is your feet should be hip width distance apart. Make a namaste pose with your palms in front of your chest and engage your abs. Shift your weight onto the right foot and gently lift the left foot off the ground and on the back of the right calf muscle or inner thigh. Gaze to a point in front of you to maintain balance. Hold this position for 5 to 8 breaths and repeat by changing the legs. Repeat this exercise 5 times a day. Advantages: tree pose stretches the muscles of the thigh, groin and shoulders. It builds tone in the abdominal muscles, calf and shoulders. Precautions: patients experiencing headaches, insomnia, low blood pressure, dizziness, vertigo should perform this exercise with caution and preferably with medical advice. Mountain pose. Procedure: stand on your toes and take your hands above the head and stretch the whole body in the upper direction. Breathe in and out with control for 2 minutes. Advantage: stimulates the nervous system, improves body balance and posture, strengthens the abdominal and gluteal muscles, and improves the function and capacity of respiratory and digestive systems. Precautions: patients experiencing headaches, insomnia, low blood pressure, dizziness, vertigo should perform this exercise with precautions. Mountain pose. Next, chair pose. Procedure: try to sit on an imaginary chair with raised arms. Concentrate on your breath and maintain this posture for 2 minutes. Repeat for 5 times a day. Advantages: stretches the shoulders and chest, tones up digestive system and cardiopulmonary system. Precautions: patient with lumbar disc disease, spondylosis, osteoporosis, hip arthritis, and knee arthritis should do this exercise with precautions. chair pose. This is the chair pose, figure number 7. Figure 8, exercise 8, modified Sukhasana procedure. Sit on floor or mat with folded legs. Extend the sides of the body and lift the spine. Now lift the arms above head and slowly place them behind the back of the floor. Maintain this pose for 10 breaths and repeat for 5 times a day. Advantages: improves flexibility of upper spine, allows optimal breathing and movement of prana, life force energy throughout the body. Precautions: patient with shoulder injuries, low back pain, cervical span, knee arthritis should do this exercise with precaution. Bridging. Lie straight on your back on floor or mat. Bend your hips and knees with feet flat on the floor. Raise your buttocks off the ground and straighten your spine while placing the arms at the side of the body. Maintain this posture for 10 breaths. Repeat for 10 times a day. Do not use a pillow while performing this exercise. Advantages: strengthens the muscles of the lower limbs, paraspinal muscles, and chest. Relaxes the whole body, reduces anxiety and improves the digestion, relieves insomnia. Precautions: patients with neck pain, low back pain, knee injuries, and shoulder injuries should perform this exercise with precautions. Bilateral side stretches procedure. Sit towards the front of the chair with your legs wide, knees and toes pointed out. Place your right hand on the right thigh and lift the left arm towards the ceiling. On an inhale, each straight up, reach straight up, then exhale to the side bend over to the right. Hold for 5 breaths and repeat the same on other side. Advantages: chest expansion, improves chest mobility, improves ventilation. Precautions: patients with neck pain, low back pain, shoulder injuries should perform these exercises with precautions. Apart from above exercises, the following breathing exercises shall be beneficial in improving the ventilatory capacity and efforts. Anulom Vilom. Sit in Sukhasana or Padmasana with spine straight. Using the right thumb, block the right nostril and inhale through the left nostril for 2 seconds. Now block both nostrils and hold the breath for 4 seconds. Repeat the same with opposite nostril. Repeat for 10 rounds. Advantages: it helps in relieving anxiety and depression, warm up the body before doing other exercises, helpful in treating respiratory problems and high blood pressure. Precautions: cardiac patients, hypertensive patients, and pregnant women should not hold their breath while performing this exercise. They should just keep on inhaling and exhaling. Anulom Vilom. Next, pursed lipped breathing. Sit in Sukhasana or Padmasana with supine straight. Relax shoulders as much as possible. Now inhale through your nose for 2 seconds. Feel the air move into your abdomen. Now purse your lips. Make a small opening in the mouth and exhale twice as long as you breathe in. Repeat for 10 rounds. Advantages: relieve shortness of breath by slowing the breath rate. Keep the airways open for longer time, decreases work of breathing, improves ventilation. Precautions: cardiac patients, hypertensive patients, pregnant women should not hold their breath while performing the exercise. They should keep on inhaling and exhaling. Diaphragmatic breathing exercises. Procedure: lie straight on your back on floor or mat with a pillow under the knees and head. Place one hand on the upper chest and the other just below your rib cage. Breathe in slowly through the nose so that your stomach moves out against your hand. The hand on the chest should remain as still as possible. Repeat for 10 times. Advantages: it helps in strengthening the diaphragm, decreases work of breathing, and decreases the oxygen demand. Precautions: patients with bronchial asthma, chronic bronchitis, reflux gastritis, recent rib or chest injuries should perform this exercise with care. Huffing. Sit straight with chin tilted slightly up and open your mouth. Take a slow deep breath and hold for 2 to 3 seconds. Now exhale forcefully but slowly, continuously such that the mucus moves from smaller to the larger airways. Repeat the cycle for 4 to 5 times. Advantages: clear the airways, moves the mucus from smaller to larger airways, assists in chest clearance and improves ventilation. Precautions: patient with uncontrolled hypertension, glaucoma, and pregnant women should not hold the breath. You can see those exercises once again. This slide. Please go through the exercises to improve the immunity. You can advise these exercises to your patients. Only thing is, pregnant women, hypertension patients, recent rib and chest injuries, they should not hold the breath. And then this is the acupuncture point. Just try it out if you have digital pulse oximeter. If you have pulse oximeter, keep on your finger and then press here and see the reading. You can feel immediately the difference. And these are the active light exercises which improves the mood, elevates the mood, and alleviates the anxiety and stress among the patients. So whenever you were posted in the ICU, not only in COVID ICU, any ICU, if you can make the patient do these simple exercises depending upon their capacity, it will activate their mood and it prevents depression, hospital acquired anxiety and depression. So that's for today's class. So this you already seen shortwave diathermy application. So that's for today's class. Any doubts?
Sir,
Hello.
yes, sir. When you've given these treatments, the manual techniques on positive patients as well,
Dr.
sir?
Hina, your voice is not clear.
Am I audible now, sir?
Yeah, yeah.
I'm saying, sir, that the manual techniques which you've used on the patients who were positive as well, or after they
Yeah,
were negative?
they are COVID positive in the ICU.
Okay, so because there were a lot of guidelines which say that we have to prevent the manual contact, that's why I'm asking. I thought I
No,
was the
no, no,
only
no,
one
no.
who used a
This
lot of
time,
manual techniques.
yeah, we have given around 360 patients.
Yes, sir. Because when I was there, I have also used a lot of manual techniques.
Yeah, yeah.
Because without
See,
that,
we have given even postural drainage. We have
yes.
even given postural drainage. We
Hmm.
made the patient cough. We have
Yes.
even suctioned the patients.
Yes, sir, that was needed actually. So that I just asked out of query because when I was there in the ICU, na, I read a lot of
Uh,
guidelines. Everybody
we
was
we
saying,
we have we have even suctioned the patient.
hmm. Even I did everything. We
Uh,
made them cough
because
hard.
that is more important.
That was actually important at that time.
Yeah. Acha, Hina, I have one more doubt.
Yes, sir.
See, test. With this we have completed unit 3.
Okay, sir.
Okay. Unit 1 and 3. Actually, I was told that I need to teach unit 1 and 3.
Okay.
Okay. And but Dr. Digvijay told me